Hello friends, welcome to Srinatralaya. In this video we will see a case of small pupil with pseudoexfoliation. The pupil is 4 mm and non-dilating. The main port entry is 2.6 mm, which is taken half only in the initial stage to form the anterior chamber comfortably and have more space for manipulation. Intracameral adrenaline tried but didn't work. This is followed by injection of trypan blue below the iris and in the center to stain the capsule nicely for better visibility, which is mandatory. Trypan blue is washed off with saline and visco is injected into the anterior chamber to form the anterior chamber nicely and have enough space for manipulation. Performing a CCC is very crucial in such scenarios where we have weak zonules and a small pupil of 4 mm. This is totally unedited video. I am taking a flap and taking the margin of my pupil size as a guide to perform CCC. We can note here I am performing CCC and taking it to the center so that all the vectors are pulled towards the center and running away of rhexis is rare. Once rhexis is complete and anterior chamber is formed with viscoelastic, the small main port entry is enlarged to 2.6 mm for phacoemulsification. One can examine the anterior capsular flap over the cornea to confirm the size of rhexis performed. Hydrodissection is a very important step and it has to be performed meticulously. One can note the fluid wave behind the nucleus and confirm that hydro is completed. Rotation of nucleus is second thing, which is very crucial. Now again the chamber is formed with viscoelastic. Here I am using a sustainer which I usually use with pre-chopper. It has a blunt ball point tip and a long prong in the distal end for better manipulation of nucleus. You can see the nuclei is not very hard here. I am taking out the cortical material, and as soon as I am getting an equator, I can very easily use my horizontal chop technique and go behind the nuclei and cut it into two pieces with the help of phacoemulsification, and subsequently making multiple small pieces and taking out each piece separately. Once you have a small piece in cases of small pupil situations, take out and eat away that small piece so that you will have more room for manipulation for the subsequent pieces. Once the nucleus is out, to take the cortical material, my left hand instrument is coming to periphery so that it will not cause any chances of PCR. Once this is done, visco is again injected and a step of coaxial irrigation aspiration is performed. To start with, I usually start at subincisional level and then make a sweeping movement to the sideways so that I can take away all the cortical material comfortably. In small pupil scenarios, the visibility is less and leaving behind the cortical material is not uncommon. So make sure that you are taking all the cortical material completely. Here I am loading the IOL in the cartridge. In small pupil cases, it is very important to keep your phaco probe in the central area so that you should not catch iris, and there only you have a maximum room for manipulations. The IOL is injected, the leading haptic goes to the bag, and with the left hand, the trailing haptic is dialed into the bag. This is followed by a viscoelastic wash with coaxial irrigation aspiration cannula. And here you can see I had left a cortical material which was sub-incisional and didn't notice previously. So rotation of IOL in the opposite direction helps in removal of any cortical material which is left behind. I hope you enjoyed. Thank you and good day.